Hello everyone. So today I am going to deal the topic electroconvulsive therapy. So electroconvulsive therapy is one of the treatment modalities which commonly used in mental health nursing. Apart from this, we are using some psychopharmacology, psychotherapies to treat mental disorder. But electroconvulsive therapy is one of the major treatment which commonly used for treating majority of the psychiatric conditions. So come let me discuss about what is electroconvulsive therapy. So we are going to discuss about the introduction, definition, parameters, types of ECT, applications of electrodes, indications, contraindications, side effects, the ECT team, treatment facilities, and the role of nurse in the electroconvulsive therapy treatment. So to talk about electroconvulsive therapy, so this one was started in the year of 1938, which was introduced by the Binney and Carlyle. And from 1980 onwards, the electroconvulsive therapy it becomes one of the major treatment modalities which they are commonly used in treating the psychiatric disorder. And coming to the definition of electroconvulsive therapy, so electroconvulsive therapy is the artificial induction of grand mal seizure through the application of electric current through the brain. So commonly what will happen here in the electroconvulsive therapy, they are applying the electrodes, and through that electrodes they are passing the current. That current will be generating the grand mal seizure. With that, mainly the mechanism of action takes place into the electroconvulsive therapy. And coming to the parameters, here the common parameters used is voltage. Commonly they are using 70 to 120 voltage of current, and they are using for 0.7 to 1.5 seconds of fraction only, because here when we talk about the electric current, we know the adverse effect of electric current. So they are using only 70 to 120 voltage of current for the duration of 0.7 to 1.5 seconds. And coming to the types of seizure, already discussed in the definition, the grand mal seizures are commonly produced. Here it is mainly of two phases, one is tonic phases, another one is clonic phase. And tonic phases which is lasting for 10 to 15 seconds, and clonic phase which is lasting for 30 to 60 seconds. Coming to the types of ECT, here the ECT is mainly classified into two types. One is direct ECT, another one is modified ECT. So direct ECT is the ECTs which is given in the absence of anesthesia and muscle relaxant, and which is not now currently they are not existingly using this method of ECT. But now they are using the modified ECT, where it refers to the ECT is given under the anesthesia as well as in the muscle relaxations. And the frequency and the total number of ECT, frequency is commonly it is prescribed 3 times per week, but sometimes it is indicated, depends on the conditions. And the total numbers, their prescription is 6 to 10 ECT, and maximally sometimes 25 may be indicated according to the condition of the patients. And talk about the important aspect, that is application of electrodes in the ECT. So here where the commonly the electrodes are placed, and there are mainly two methods of application of electrodes. One is bilateral, another one is unilateral. So just you can see in the diagram here, the bilateral where they are applying for the both the sides, and where the unilateral they are applying only for the one side. So here in the bilateral, commonly the electrode is placed at 2.5 to 4 centimeter, that is 1 to 1.5 inch above the midpoint, the line joining between the targus of the ear as well as the lateral canthus of the eye. Just you can see here the landmark which they are drawing the line between the outer canthus and the tragus of the ear, and midpoint where they are drawing, and they are measuring for 2.5 to 4 centimeter. And coming to the unilateral, so unilateral, the name itself we can say, where the electrodes are placed in one side, and commonly the electrodes are placed on one side of the head, usually on the non-dominant side. If there is a right-handed person, they are commonly applying the electrodes at the right side of the patients. And indications, in which conditions commonly we give a ECT. So ECT is not indicated in all the psychiatric conditions, but majorly certain indications which are listed is, one is major depression. Commonly the patient who is suffering with the depression, that time commonly we use a ECT. Second one is severe catatonia. This commonly we see in catatonic schizophrenia. Also some of the catatonic movements, if the patient is having, we commonly use this ECT. And next one comes severe psychosis, also called as a schizophrenia, and commonly in all schizophrenic conditions this ECT is indicated. And also we are using this one in some organic mental conditions like delirium and dementia. Apart from that, some other conditions which includes the patient who is with the cardiac diseases and who are receiving the tricyclic antidepressants. In that case, commonly we give this ECT. And in case of pregnant woman who is receiving the antidepressants also, we are giving the ECT, because in this case the pregnant mother, when they receive antidepressants, it may cause some fetal harm. It causes mainly the congenital anomalies. That's the reason we commonly use this ECT in these cases. And coming to the next part, that is contraindication, in which conditions we cannot give this ECT. And these contraindications are mainly classified into two categories. One is absolute contraindication, another one is relative contraindication. Absolute contraindications commonly refers in case of raised intracranial pressures. Commonly we are not going to prefer the ECT. And in case of some relative conditions includes like a cerebral aneurysm, cerebral hemorrhage, brain tumor, acute myocardial infarction, congestive heart failure, pneumonia, retinal detachment. In these relative conditions also the ECT is not indicated. And coming to the next, the side effects. We know the adverse effects, where every treatment has got some the benefits as well as some adverse effect. Here ECT also has some adverse effect. As we know, we are passing an electric current to the brain. It may cause some disturbance into the brain. Also it may cause some of the adverse effect into the body, and that adverse effects are listed like the memory impairment, drowsiness, confusion, restlessness, poor concentration, anxiety, headache, weakness, backache, dryness of mouth, tongue bite, unsteady gait. So these are the common side effects which are commonly faced the patient who is receiving the electroconvulsive therapy. Coming to the ECT team. So here the team members of the ECT includes, the first one is psychiatrist, who is a major important role. So under the guidance of the psychiatrist, under the surveillance of psychiatrist only, the ECT is given. And next one is anesthesiologist. We know, as we are now currently using a modified type of ECT, anesthetic agents are administered to the patient. So anesthesia is important, and the trained nurses, because majority of the roles are taken in the ECT by the trained nurses, so it is important. Apart from that, some of the aids which are necessary for helping for the ECT team, that can be included in the ECT team. And coming to the next, treatment facilities. So your treatment facilities in the ECT are mainly classified into the pre-ECT room, ECT room, and after a post-ECT room. The post-ECT room is also called as a recovery room. So pre-ECT room, where the patient is prepared for giving the ECT. Here some of the certain responsibilities which will be taken place, like preparation of the patient, preparation about the administration of certain drugs. And ECT room, which is the major important things we have to focus, like where the ECT room should be equipped with the ECT machine and accessories, some anesthetic appliances, some face masks, oxygen cylinder, covered depressors, along with some emergency drugs. Because we know during the time of ECT the complications may arise, and to handle that complications, commonly what we are using is, during the ECT room we are using all the emergency equipment as well as emergency drugs. And the third one comes to the recovery room. The recovery room is also referred as a post-ECT room, where the patient are just shifted for recovering, where we have to observe the patient for certain things, and we will discuss what are the things we are going to observe into the last phase. And coming to the next part, that is when we consider for the nurses, the role of nurses becomes a very important when we are handling in the ECT and when we are handling the patient with the ECT. So here, as in the treatment facility, we have three areas like a pre-ECT, ECT room and post-ECT room. So here role of nurse also are described into three categories. One is before ECT, during ECT and after ECT. And what are the role of nurse in the pre-treatment evaluation? So as a nurse, we need to collect a detailed medical and psychiatric history of the patient to know any of the conditions, like it may be indications, certain contraindications or certain conditions where they are suffering with medical or any psychiatric conditions. And coming to the second one is, we need to assess the patient as well as family knowledge about ECT, because how much they know about the ECT. Because we know we need to explain the indications, contraindications. We know certain adverse effects which are going to happen for the ECT. We need to understand how much they are aware about the ECT. And informed consent is a major important things which comes into the ECT, because we know where we are dealing with the patient with electric current, and this procedure may harm to the patient. That's why the informed consent is very important. And assessing the baseline vital signs, which here mainly includes the temperature, pulse, respiration, blood pressure monitoring is important, because vitals may vary whenever the ECT is given. And patient should on the empty stomach before 4 to 6 hours, that is in the morning, advise the patient to not take any food. And withhold the night medications. Commonly, if the patient is receiving any drugs like a diazepam, barbiturate, anticonvulsants, if the patient is receiving this drug, advise the patient to not take the drugs in the night. Also along with that, we have to withhold the oral medications in the morning. Any type of medications, if the patient is receiving in the morning, we have to stop the medication or we have to withhold the medication in the morning. And head shampooing is a very important procedure here before going for the ECT. If the patient is applied any oil appliances to the hair, that should be removed with the help of hand shampooing, because oil acts as that is impedance the passage of electricity to the brain. And if the patient is wearing any jewelries, prostheses, any kind of dentures, contact lenses, metallic items, if the patient is wearing tight clothing, we need to remove all the ornaments, tight clothing, everything to make the patient comfortable. And empty the bladder before the ECT. And the important things comes here, administration of medication. Here the important medication which we are administering is the atropine, that is 0.6 mg, which we are administering intramuscularly or subcutaneously 30 minutes before. If you are administering IV, we have to administer the ECT before ECT we need to administer the atropine intravenously. And coming to the next, the intra-procedure care, that is nothing but on the time of ECT in the ECT room, the major important roles of the nurse comes. Place the patient in a comfortable ECT table, which includes the supine position, and stay with the patient, because we know once the patient comes to the ECT room, the patient may be anxious. So we need to continuously be with the patient to allay the anxiety and fear of the patient. And next we need to administer the medications which are important. One is anesthetic agent, another one is muscle relaxant. The anesthetic agent commonly we are administering is thiopental sodium, that is 3 to 5 mg per kg body weight we need to administer. And muscle relaxant, that is succinylcholine, which we need to administer 1 mg per kg body weight. So these are the two medications which we are administering during the time of ECT. And since we know that we are giving the muscle relaxant, our important role is to see that the patient have maintained the patent airway, because when we administer muscle relaxant, commonly it also relaxes the muscles of the respirations. So that's why we need to see that the patient airway is patent. And next important thing is, as we know, it is artificial induction of grand mal seizure. The mouth gag is placed because once the grand mal seizures are produced, the patient may have the risk of developing tongue bite. So that's why mouth gauges should be placed to prevent the tongue bite. And the next comes the electrode placement. Before electrodes the placement, see that the area of the electrode placement should be cleaned with the saline water, and also we need to apply a conduction gel which will help for the easy transmission of electric impulses to the brain. And we need to monitor the voltage and intensity and duration of electric stimulus, because as I have mentioned already in the parameters, 70 to 120 voltage of current should be passed, and for the duration of 0.7 to 1.5 second. So that frequency and intensity should be maintained here. And we need to monitor the seizure activity here, because we know artificially we are inducing the seizures. We need to monitor the seizure activity, and we have to make sure that 100% of the oxygen is supplied for the patients. And during the seizure, we need to monitor some of the vitals. We have to monitor with the ECG, we have to monitor EEG. If any additional investigation should be done, any references can be done with the time of ECT. And see that once we finish the ECT, we need to record the medications and record all the vitals, anything investigations which have done the time of during the ECT. And coming to the next, that is the post procedure care, that is in the post ECT room, also we call as a recovery room. So here the role of nurse includes, first monitor the vital signs. It includes maybe a temperature, pulse, respiration, blood pressure, oxygen saturation. All the vital things should be monitored to see any abnormalities or any imbalances which are occurring into the vitals. And we have to continue the oxygen as we have administered the oxygen during the time of ECT. Still we need to continue the oxygen till the patient starts with the respiration, and assess for post-ictal confusion, because we know once the patient go for developing the ictus, that is nothing but the convulsion, there is some time of confusion is commonly seen in the patient. So we have to observe that post-ictal confusion, and we have to take a certain safety precautions to prevent injury. Like the important two safety precautions is, one is a sideline position. Why it is? Because we know as the patient is receiving the anesthesia muscle relaxation, there is a chances of aspiration. So to avoid that aspiration, we need to maintain a sideline position. And second one is to prevent, you have to use a side rails, because we know that it is producing a grand mal seizures. Whenever the grand mal seizures are produced, commonly we know that there is increased body movements it occurs and increased motor activity will be present. To avoid injuries, we have to provide a side rails. And if there is a severe post-ictal confusion, if you can see in the patient that there is a post-ictal confusion, then we need to administer a IV diazepam, so that it will help to reduce the post-ictal confusion. And we have to reorient the patient after the recovery and stay with the fully oriented. See that the patient is completely recovered, reoriented to the time, place and to the surrounding. Then make sure that the patient is in the recovered things. And once last you finish the procedure, the important thing in the nursing is recording and reporting. So as a nurse, we need to record all the pre-ECT, intra-ECT and the post-ECT. So this is all about the ECT. So what is the ECT? The definition of ECT, what are the parameters which are used in the ECT, the types of ECT and the application of electrodes, and what are the role of nurse in the pre-ECT, during the ECT and after the ACT. Okay. So here I conclude the topic. So by this, hope you understand that. So what are the common methods used in the ECT and how this ECT is commonly used as a one treatment modalities in treatment of many psychiatric disorders. Thank you.